Okay, so this is a case open where we've got lower partial. We're going to end up replacing all the teeth eventually, but right now we're going to take these out and do some bone grafting because we're going to have to do some advanced techniques for these implants, and I want it all to be healthy. But to get our jaw relation today, because these teeth are mobile, we're going to, a couple of them are fairly stable. We're going to get our records today because if we got them prior and tried to align them to today, then it would be difficult because of the mobility. So what I'm going to do is just stay together just like that. I'm going to keep them in this position, and we're going to just stay together. I've already adjusted these teeth, and we're just going to paint some prime and bond and then bond them together. So I'm not going to use a wire. Maybe it wouldn't be a bad idea, but I think I'm going to be able to just do it with the flowable material. So what I need is the teeth to roll your tongue back. Right together. No.
Say biting.
Pull it away from your teeth.
And roll your tongue back.
Perfect.
Good job.
Perfect. Right together. Suction. You're doing great. Stay together. All right. So we're gonna stick these together, and then we're gonna get a upper scan, lower scan. Then we're gonna get a bite scan. And stabilizing these teeth together is gonna help us to be able to align all of our scans. So you see, I kind of push those apart. These two don't really push apart. This one I do a little bridge like this, and I'll cure that, then I'll add some. But the reason we have her biting together is because this is the position when she bites together where the teeth want to be. So it'll be easier than bonding them in the position they are where she's open, then she'd be banging into them. So let's see your flowable. You know, we want it to be perfect, but there's still maybe a little bit of movement, but hopefully, especially if we mainly align to 7 and 8, I think we'll have a nice alignment for the immediate denture. Try to let your lips relax. Doing great. Okay, open, bite together. So now you can see these are stable. This is staying together. So now we're gonna put our palatal screws in. We're gonna use those for alignment to the post-surgery. We're gonna make our Wagner impression for our immediate denture. But because we're just taking out these anterior teeth, I feel like we're gonna have pretty good initial borders on this immediate denture. And so we're gonna move along. Thank you. Then hit program, change the temp to 200. Right now it's at 212, so it's a little overheated. That's okay. All right, Dr. Rose. So this is a Wagner tray. A Wagner tray is similar to like border molding wax. And it is what we use for final impressions at Bullard Dental. So today we're doing placing an immediate denture. We scanned the teeth, took the teeth out. We had palatal screws in. Now we're going to make the final impression to get the borders, and it's going to have the screws in there. Then we're going to scan this. We're going to make the final denture, but mostly I want to show you how to use the Wagner tray. So the instructions for these, I think, say 160 degrees, but much like Ricky Bobby, what is it? What I'm about to say?
I have no idea who that is.
Much like Ricky Bobby, I want to go fast. So it's a silly Will Ferrell movie about. Don't say you don't like Will Ferrell because this is probably going to be on YouTube. Okay. You know, where's the mic? Can you put the other mic on Dr. Rose? This can't be it's when only one person has a mic. You sound far away and I sound real close. There you go. Oh. It's better if it gets like where it rubs on things, it'll, like if it was against her glasses, it'll sound scratchy on the microphone.
Gotcha.
I just wanted to do that. All right, here we go. So it's heated up. So I prefer it to be hotter so it'll get more soft, faster.
Okay.
So you can't leave it in there forever and get all mushy.
Sounds good.
But then it's hot, you know, so you want to wait a second. But now, initially I'll place this in our mouth, and I'm just going to look. I'm probably going to do some trimming with the scissors. So you can come on over here. All right, let's see the objugate. So you try to keep it like, try to not do her face, but you know. So we're going to grab an objugate because I love to see while I work. So you can look in here, Dr. Rose. This is where we extracted teeth, did some grafting, and then we had a little tear, or not tear, I cut a little extra spot here, but that's okay. Got things sutured up. The world's most honest dentist, right? Open. No pontificating here. Well, I am better than everybody. You You never heard anybody like that, have you, Dr. Rose?
Oh,
Couple
times for sure.
It's not just dentists, it's just a lot of people. All right, so when I look at this, it's looking like it'd be overextended. So I just kind of get an idea for where my vestibules are.
Take your red ball.
And open. And so what I'm going to do is grab some scissors. Just go ahead and shorten these borders. I used to grind these back, but then I realized this is much more efficient and clean. And you love art, right? So this is like a dream. It's like very satisfying to cut. You want to cut some? Here you go. You can cut that, okay. Go ahead, cut it. Isn't that nice? Isn't that, yeah. It's like,
All right.
and that they have a, what is that called where you have like satisfying sounds?
ASMR.
Yeah, see, I knew Angie would know. All right, so now I see there's a frenum right here. So I'm gonna trim it there. I'm looking over here. There's another frenum here. So what I've done, let's see your scissors. I've marked where those are. I mean, come on, Rose. How efficient is this looking right now?
Very efficient.
I mean, what we'd have done, made an alginate impression and then sent it off and got a custom tray and then ground on that. I mean, you know, let's be real here. All right, let's see. Okay, let's see where I am. So it's starting to set or get firm again. Okay, so now I'm gonna take this out and look. Okay, so now I'm a little short in these areas, but that's okay because this is a little wide.
Right.
So I'm gonna freshen my water up. Come on over. You know, I've got some YouTube followers that count on me for some quality content, you know. I do. I'll share my YouTube with you.
Okay.
It's exciting. Oh, we can't flip around here. We'll have to show the, let's see if I can do this real quick. Sorry to touch you. Hey y'all. All right, that's Dr. Rose, and that's me. I'm the one with the shorter hair. Rose has the ponytail on top of her head. All right, so again, it was already a little soft. So I probably could have dipped it in there and let a little less time. My goal for these is for the border of this to just look like I want the denture border to be.
Okay.
You know, I don't want this super wide impression because I really want Austin to say, ooh, this looks like the intaglio, these are the borders, I'm just going to copy that.
So to do that for my custom trays, I normally have that a little bit shorter so I can have more of the material, the PVS material. Do you do that?
Well, the beauty is, Rose, is that you can do that with the tray.
Okay.
So you just make the tray the thickness you want.
Okay.
See how we're doing on the front. Looking pretty good.
Okay, so you border mold with this tray.
Yeah, this basically is border molding wax. I mean, it's a proprietary compound, but I mean, it's like open. All right, I'm gonna let this cool a little bit in a good position here. And I don't know how you could do a better immediate denture than this. This takes a lot of guesswork out of this process. All right, still a little overextended here. And it's pretty fast. It's a lot faster than it used to be for me. All right, could I get the little electric handpiece and actually I just need an acrylic burr because I could use the implant handpiece. I try to do minimal adjusting with the burr of this because it gets this blue flakes everywhere. We may do 0, but I just want to be ready. Rose, do you listen to country music?
I do, yeah.
That's good. We've converted a lot of people.
Yeah,
they're like, I've never listened to country music.
No, I had a moment last year where I was like, wow, I'm listening to country in my car. Who am I?
That's funny. That makes me think of parents I was talking to some parents the other day, and they were like, they're like, oh wow, we're like 4 episodes into Bluey right now, and our kids are in bed. You watch some cartoons, don't you, Angie?
I sure do.
What's your favorite cartoons?
Adventure Time.
Adventure Time. All right, I think those are reasonable borders. What do you think?
Yeah, looks good.
Yeah? So what we're going to do, then we go to the ice bath. So the ice bath, just drop it in there. Usually it has ice, but woo, it's cold. I'm gonna do a cold bath. What do they call that? Cold plunge? Just with my fingers though. One time when I was a kid, I got really hot. We were on a camping trip with my cousin's family, or my cousins, and I got back and I was overheated, and there was this cooler with ice and water in it. I stuck my head in it to cool myself down, and then the dad got back and he was like, "That's our ice, like for our drinks." So they had to dump it out. It's like,
Funny.
that was a mistake.
Some people swear by the cold plunges.
All right, so yeah, they do. So we have a hole here. This is adapted well. I'm going to put a hole here and here
Okay.
for relief from pressure. And then I'm going to let the team slinging blue. All right. All right. There's still a little bit of debris in the hole, but I'm not too worried about that. It'll still flow. All right, so Angie's going to dry this, and then she's going to paint it with PVS adhesive all on the inside. The trick, the key to adhesive is thin. Thin. You want it. Touch that, Angie.
Mm-hmm.
You want your adhesive nice and thin. Did it get in focus?
Not really. Okay, there we go.
All right, there we go.
Mm-hmm.
So you want your adhesive nice and thin. Angie's going to paint that on. Then we're going to make our impression with, we're going to use light body. We're going to use extra fast crown and bridge material. It just sets fast.
Okay.
You just have to be quick. And we'll capture the screws. And I think we'll have as good of an immediate denture impression as you can make.
Awesome.
Perfect.
Thank you.
Yeah.
Very good. Okay, we are back here to make our immediate denture impression. And Dr. Rose, it is important that you convey how important it is for your adhesive to be thin. Mm-hmm. And they did it. Sky and Andy did a great job here.
Great.
So if you have thick adhesive, when you stick your finger, it'll string out, and the weight takes a while. But if you just initially paint it thin, it works. It's the best. All right. And like a thick impression or a thick adhesive, if it's still kind of stretchy like that, it's not gonna do its job of holding the material, Mm-hmm. All right, so we're gonna. You still have the suture out, I think. Oh, perfect. Tell you what I'm gonna do first. You video this. We're just leaking right here a little bit, and rather than what I'm going to do here is just go ahead and add one suture. Turn to your left. Thank you. So we are using sedation today, but we do a moderate sedation. So our patients can hear what we're saying. They can turn their heads, but with the medication that we use, it's not just relaxed, and they generally don't remember much. But it's different than a general anesthesia or even a deep sedation. We just want our patient to be safe, control their, be able to breathe safely, and just be comfortable, be chill. You like to sew?
I do. Well, I haven't done it in a while.
Yeah. Usually one joke I'll make is after we extract the tooth. I have a few jokes I tell, but one of them I say, hey, I tell the patient, if you ever meet my wife, and it's really important now, and then they listen and say, don't tell her I know how to sew. She'll have me mending socks. But it is known in my house that, there you go, stay open wide. It's known in my house that if something needs to be sewed, they give it to me.
Oh, yeah?
Yeah, but it's usually I don't do any high level sewing. It's just
do you hem pants?
No.
Okay.
Although my mother-in-law, she's showing my daughter how to do a little sewing.
Okay.
Which is awesome. Yeah, we looked at like a basic sewing machine.
Yeah.
Would you sit the chair up a little bit, please?
Yes, sir.
And they're not, basic ones aren't expensive.
Mm-mm.
Catherine was interested in just crafts, Okay. Yeah, head up, please. Just to kind of help a little bit with the. Okay, so now, see, open. Okay, so now I'm looking, and after doing that, and she's closed down a little bit. You got some fluid in these screws, so that's really important. Those screws need to be clean and dry. Okay. All right, so you got your material. You bled this?
Yes, sir.
Yeah, I just need one. Don't worry. All right, so what I'm gonna do is express this. And it looks good. All right, one thing is you gotta be quick, and because this is so well adapted, it doesn't need to be thick. If you make it real thick, it's just gonna be running down the throat. Following the principles we have of, a couple air bubbles there. And open. So I kind of seat it in the posterior first. Try to cut down some of the stuff running off the back. Open when I get it seated. One thing is, don't don't overseat final impression, because then you'll make pressure places. You know, you get your borders where you want them, and then you just gently seat it. And even if it's like a little bit not all the way seated, you're doing great. Breathe through your nose. That's okay, because it's just filled in with pressure material, you know. Alright, I think we're pretty much at the point of. Alright, you're doing great. Just breathe through your nose. Tighten this a little bit. And I'm going to push it to the T. Back up a little bit. The reason I'll put it on 2 because it's just not focusing that great today. There you go. I put it on 2 because a 1 gives a little bit of like a fisheye type distorted lens. So it's good for taking a picture of a group of people, like close up. But when you go to 2 plus, it gets closer to being like a 1-to-1 even. Alright, we're gonna pause. Got it on 2, 3 times. Alright, that's fine. Alright, so we've taken our impression out there. We have a very nice scan of these screws. I'm going to trim up the posterior of this impression because I want to make the distal of my impression the distal of the denture. And then we're going to scan this in, and then Austin will be able to design our immediate denture. Okay? Alright, you can come over here. I'm looking in the mouth just to where I want my denture to end, which is about right at the, I think these are the fovea palatina, these guys. Over here, this way. So right here, if I got my terms right, sometimes I do it, sometimes I don't. So I probably should have trimmed this tray up to this point, but I'm just gonna trim the impression material. So let's see, there, come forward just a little bit more. But I believe that Austin will be able to just use this as the posterior border. I'm not gonna trim the blue off, okay? So we're gonna make that the posterior border. We'll put our posterior palatal seal right there. And that should line up nice. I'm just gonna go ahead and scan this. So if you're trying not to scan her, get her, pick her name on the video.
Okay.
All right, so what we're gonna do here, start there. In this impression, it's so stable. I mean, the scan path isn't as critical as it is in some other situations, because it's all gonna stitch together nicely. Nice camera angle there. When I was looking, I was thinking, oh man, I hope she's getting the screen, and you're getting both just fine. This guy's a former videographer here.
Retired.
That's right. Early retirement. All right. Okay. So that looks nice. The little, the ridge parts of the screws have a little bit of voids in there, but the flat part of the screw, the smooth part's gonna work out really well. So we'll trim this off, and we'll send this off to the lab. He'll be able to line up using these screws to the pre-op, and then he'll be able to then have the borders and the intaglio. This will be the distal of the denture. Then we'll have a real nice immediate denture. Perfect. Thank you. Come on closer. Ready? Right. All right, here we go. All right, so we did our immediate denture surgery yesterday. End goal in this case is to have some implants. That's right, right?
That's right.
Great. So, but we use our workflows for that. Open for me. There's a little knot of tissue right there, but I'll probably take that off when we do the final surgery. So we made our Wagner tray impression yesterday. You can see where we blocked out where we had this palatal screws there, and got a posterior palatal seal. So I'm just going to wet this a little bit. We're going to try it again. Don't bite me. Already looking nicer. All right, good. You can see, look at there, got some suction, all right? So that's great. So for an immediate denture, I mean, that's hard to beat. We got suction, the borders look great, and then let's check out this jaw relation. Go ahead and bite together. Oh, would you look at that? Nice and even. Bite together. Okay, smile real big. Perfect. Okay, so now this is going to set us up for the future. Basically, this is going to be a healing denture, and we're going to move on to the implant-supported prosthetic in the future. We just need to get through some, heal up some areas with some bone grafting and things. But all right, very good. Thank you. Thanks, guys. Here you go.
Oh, wow. That's so wonderful.
Good. You like it?
Uh-huh.
Good. Well, Austin did a great job with the design.
He did.
The ladies did a great job. And
thank you all so much.
You're welcome. You're welcome. So, and then we'll get through the denture part. We'll have you some fixed teeth before the
Hey.
end. Okay.
That would be wonderful. I'm looking, what, about January? Didn't we say? Like 4
Yeah,
months?
is that 4 months? Yeah, 4 months should be good. All right.
Hey, thank y'all so much.
You're so welcome. All right, good deal.